Frequently referred to as the filtration system of the body, the kidneys play a significant role in the process of preserving a healthy internal environment. Located in the posterior wall of the belly, these bean-shaped organs perform a variety of activities that are essential to the body's overall health and well-being. The terrible reality is that kidney disorders frequently do not present any symptoms in their early stages, which can result in a delayed diagnosis and the possibility of complications. This video digs into the 9 most common symptoms that are related with kidney illnesses, illuminating the significance of these symptoms, as well as the value of starting early detection. When it comes to protecting kidney health and obtaining medical attention in a timely manner, having an understanding of these signs can also be of great assistance. Number 9. Change in urinary function. When it comes to the elimination of waste and extra fluids from the body, the urinary system is an extremely important component. Any disturbance in this process has the potential to serve as an early signal of failure of the kidneys. Alterations in urinary function frequently present themselves as variations in the frequency, volume, and color of urine. Possible indications of an underlying problem include a noteworthy change in the color of urine, which typically has a pale yellow hue to a darker hue. In addition, it is important to not disregard a continuous urge to urinate, particularly when it is accompanying changes in the quality of the urine. One of the most prevalent symptoms of chronic kidney disease is the need to urinate frequently. This is an indication that the kidneys are having difficulty maintaining their regular function. Number 8. Shortness of breath. The effects of severe kidney illness can extend far beyond the renal system and have far-reaching repercussions. One of these consequences is the accumulation of fluid in the lungs, which might impede the process of oxygen removal from the body. Shortness of breath is a symptom that should not be taken lightly and should be considered a potential consequence of this interference. As a consequence of poor kidney function, there may be a deficiency of oxygen in the bloodstream, which can lead to issues with breathing. Recognizing the systemic impact of kidney illnesses requires first and foremost an understanding of the relationship that exists between the health of the kidneys and the function of the respiratory system. Number 7. Blood in the urine. The presence of blood in the urine, sometimes referred to as hematuria, is a warning sign that requires quick response from medical professionals. Despite the fact that hematuria may not always be directly associated with kidney problems, it can be an indication of a variety of difficulties, such as kidney injury or, in some instances, prostate cancer. Any incident of blood in the urine should require a comprehensive medical evaluation to discover the underlying reason and begin therapy that is appropriate for the condition. Diagnostic and treatment of kidney-related illnesses in a timely manner can have a major impact on the prognosis of these conditions. Number 6. Foamy urine. Despite the fact that it may appear to be harmless, a pee that is cloudy can be an indication that protein is escaping from the body. Proteins, germs, sugar, and other chemicals leave the body through the kidneys and into the urine, which results in the formation of a foamy look in the urine. The occurrence of this event offers extremely helpful insights into the inner workings of the body. There is a strong correlation between renal illnesses and proteinuria, which is defined as the presence of an excessive amount of protein in the urine. It is possible to contribute to the early diagnosis of kidney disorders by monitoring and resolving foamy urine, which gives the opportunity for rapid intervention. Number 5. Swelling or edema. The kidneys are responsible for taking care of the body's fluid and electrolyte balance, which is a very important function. A condition known as edema can develop when kidney function is reduced because it makes it more difficult to eliminate waste and extra fluid. This condition typically presents itself as a puffiness and stiffness in the hands, feet, and ankles for the patient. Symptomatic of the body's battle to control its fluid levels, edema is a visible sign of this struggle. In order to avoid further difficulties that are linked with fluid retention, it is essential to recognize edema and take action on it as soon as possible. Number 4. Pain in the back or sides. Back discomfort is a common sign of kidney disorders since the kidneys are located in the back and sides of the body, which is its anatomical location. There are a number of underlying disorders that can lead to back pain that is associated with the kidneys, including polycystic kidney disease, inflammation, infection, cysts, and several malignancies. If you are experiencing severe or persistent pain in your back or sides, you should not dismiss it as merely being uncomfortable. This serves as an important indicator that requires medical attention in order to arrive at an appropriate diagnosis and begin treatment as soon as possible. Number 3. Fatigue, anemia, and weakness. The kidneys are responsible for the generation of erythropoietin, which is an essential hormone for the creation of red blood cells. Erythropoietin production experiences a decline when kidney function is impaired, which ultimately results in a reduction in the generation of red blood cells. Another name for this ailment is anemia, and it can cause symptoms such as weariness and weakness. It is of the utmost importance to have a knowledge of the connection that exists between kidney function and the generation of vital hormones. It is important to not ignore feelings of fatigue and weakness, because they may be signs of an underlying kidney-related problem that requires a formal medical evaluation. Number 2. Low concentration and dizziness. Low concentration and dizziness are notable symptoms associated with anemia in the context of kidney illness. Anemia not only hampers the ability of red blood cells to effectively transport oxygen throughout the body, but it also has a profound impact on the amount of oxygen supplied to the brain. This dual consequence of anemia can lead to cognitive and sensory disruptions, affecting the overall well-being of an individual with kidney-related complications. The brain, being highly dependent on a continuous and adequate supply of oxygen for its optimal functioning, becomes vulnerable in the presence of anemia. The impaired oxygen-carrying capacity of red blood cells compromises the oxygen delivery to various organs, including the brain, and this deficiency can manifest as a decline in concentration and episodes of lightheadedness. In individuals with kidney issues, recognizing these cognitive and sensory signs becomes crucial for a comprehensive assessment of kidney function. The interplay between anemia, kidney dysfunction, and the resultant impact on cerebral oxygenation underscores the complexity of managing kidney-related conditions. As healthcare professionals aim to address the root causes of anemia in the context of kidney illnesses, they must also be vigilant in monitoring and managing the associated neurological symptoms to ensure a holistic approach to patient care. This entails not only treating the anemia itself, but also considering its broader implications on cognitive function and sensory well-being. Number 1. Persistent cold. Persistent cold sensations, seemingly inexplicable in warm environments, may be linked to renal disease. This connection arises from the impact of kidney problems on blood circulation, leading to a perceived sensation of coldness throughout the body. The phenomenon of persistent coldness is not to be dismissed as a trivial discomfort. Rather, it should serve as a prompting signal for a thorough examination into potential kidney-related causes. The loss of blood associated with kidney dysfunction can manifest as a consistent feeling of cold, signaling an underlying issue that necessitates medical attention. It is crucial to recognize that persistent cold sensations, when observed, should not be overlooked. Instead, they should be regarded as potential indicators of an essential problem within the kidneys, prompting a proactive approach toward diagnosis and subsequent medical treatment. Acknowledging the significance of this symptom is integral to a comprehensive understanding of the potential complexities associated with renal health. Because kidney illnesses frequently advance without any obvious symptoms, it is essential to be aware of the various symptoms that may be present. In order to provide timely assistance, it is essential to recognize the significance of changes in urinary function, difficulty in breathing, blood in the urine, foamy urine, edema, back discomfort, exhaustion, problems with concentration, and persistent cold sensations. The interdependence of kidney health with other body systems highlights the significance of taking preventative measures to check one's health. It is possible to contribute to the early diagnosis and effective management of kidney-related diseases by having regular checkups, being aware of potential symptoms, and seeking medical attention as soon as possible. This will eventually protect one's general well-being. What do you think of our video? Let me know in the comment section below. If you enjoyed this video and want to hear from me again, be sure to hit that subscribe button before you go. Thanks for watching.